To perform suctioning with a closed or inline suction catheter, prepare the patient. And if a respiratory therapist has not already attached the closed suction catheter to the mechanical ventilator circuit, or if the inline suction catheter requires changing, open a suction catheter package using aseptic technique. Then put on clean gloves. Remember to reassure the patient that she will be off the ventilator just for a moment while the suction device is being connected. Connect the device as efficiently as possible to reduce the time the patient will be off the ventilator. Turn on the suction device and set the vacuum regulator to a suction pressure range of 80 to 120. Higher settings could cause trauma to the airway. Now connect one end of the connecting tubing to the suction machine and the other end to the suction catheter. If appropriate, hyperinflate and hyperoxygenate the patient with a manual resuscitator or the mechanical ventilator's manual breathing mechanism. When done, if needed, unlock the suction control mechanism. Refer to the manufacturer's directions for specific procedure. Using your dominant hand, pick up the suction catheter enclosed in its plastic sheath. Then insert the catheter into the ET tube, pushing it in and sliding the plastic sheath back between your thumb and forefinger until you feel resistance or the patient coughs. Make sure that the airway is secured by stabilizing it with your non-dominant hand. While the patient coughs, apply suction by squeezing the suction control mechanism and withdrawing the catheter into its plastic sheath. Then reassess the patient's cardiopulmonary status, including her pulse oximetry readings. If secretions haven't been cleared, repeat the suctioning once or twice, allowing at least 1 full minute between suction passes. When the airway is clear, withdraw the catheter completely into the sheath, making sure the catheter's colored indicator line is visible inside it. Assess lungs and pulse oximetry again for improvement. Now rinse the catheter with 5 to 10 milliliters of saline by squeezing the vial or pushing the syringe while applying suction. Then lock the suction mechanism, if applicable, and turn off the suction. If the patient requires oropharyngeal or nasal tracheal suctioning, perform them with a standard catheter, as shown in the appropriate video skills. Complete this procedure as you would for other types of artificial airway suctioning. As part of your follow-up care for suctioning any artificial airway, assess for signs and symptoms of complications, such as dysrhythmia and decreased oxygenation.